Okay. Well, we're excited to be here today to talk about the Deep Plane Facelift, and part of our extension of the Patient Appreciation Week, trying to communicate with our patients and just kind of touch base with everybody. And we're looking forward to, continuing with all the fun stuff that we're doing during the Patient Appreciation Week. It's been a great thing we've done for a number of years now, and it's really been a lot of fun. Patients enjoy it, and they get some good deals out of it too.
Absolutely.
So today we're going to talk a little bit about the Deep Plane Facelift, and we've got some questions that patients have sent to us, and we thought we'd kind of, between Dr. Adams and I and myself, we would kind of talk about some of those things and kind of help answer some questions that people have about facelifts in general. And I guess if you want to start off, there was a question that I think Jody had, and maybe you can.
Yeah, thank you. Yeah, no, just like Dr. Rousso said, we compiled a lot of questions patients sent in, or potential patients sent in a lot of questions. We tried to maybe get the ones that kept recurring, or the ones we see a lot in consults. And like you said, we have one that's so common, is what is a deep plane facelift? And in all honesty, I tell a lot of my patients, the reason you even know that term is it's kind of a buzzword these days. I think a lot of practices, a lot of doctors, we talk about it, and so it sort of, in a way, gets people away from maybe the general root of it being a facelift. And there's different techniques for many things that we do in medicine, and when it comes to facelifting, it's no different. And like most things in medicine, as you practice medicine, things evolve, and different techniques begin to show themselves and maybe become more popular or less popular and that sort of thing. And the deep plane facelift was described back in 1990, so it's been around for a very long time. But I think due to, honestly, the way our field is very open about sharing techniques and how much we share the good, bad, and ugly in our meetings and learn from one another, it's really catapulted that technique to the forefront. And the main thing of a facelift is actually lifting the SMAS layer of the face. And so you'll hear about SMAS facelifts or deep plane, but both of them lift that SMAS layer. And so whether you're in the neck or in the face, the cheeks, that sort of thing, it's all the same layer. It's where you get underneath that layer that starts to differ. And so with deep plane facelifts, we tend to go a little bit closer to the folds or to the jowls and those areas to do the lifting. And because of that, it tends to be a little bit more powerful in the mid-face, meaning you get a little bit better kind of cheek lift with that. You can also get a really tension-free lift on the jowls and the neck. And it's a really nice technique that through time has been, sort of built on to really give us the tools to provide great results for patients, and something we've been really enjoy doing.
Well, that's great. Yeah, I think that really helps explain. And as Austin was saying, I've been doing this a long time, and the process of evolution on many of the techniques that we do has changed over the years. Totally different from what I started doing, over 30 years ago.
Right.
And so my process of lots of things, facelifting is just one.
Correct.
Hair transplants have done tremendous differences now compared to what they were many years ago, and the results we're getting are better. So ideally, that's the idea, is to continue to do things in such a way that's safe and looks natural. I mean, that's the important thing that we strive for here in our clinic.
Absolutely.
That we want the patients to look natural. They shouldn't look overdone or stretched or over operated. And you can do that, I hate to say it, with just about any facelift technique. If you're inclined to be more aggressive and give that what I call the open cockpit of an airplane look, we don't want that, and our patients don't want that. Typically, not in this practice. Now, some places patients may want a little bit more, operated look, but our patients really want a very, very natural look. But they want a long-lasting result. They want one that's safe, that doesn't risk nerve injury and other things that are all risks of any type of facial surgery. Why don't you kind of, well, you did describe sort of what the deep plane lift does. It helps to to sort of detach some of the ligaments that are further out in the cheeks and the jowl area, to be able to lift that, especially in patients that have a little bit heavier face. Those patients probably benefit more from a deep plane lift than patients who have a little bit thinner face and not as heavy a tissue. I think that's where the big, in my experience, makes a big difference, I think, in those patients.
Yeah, absolutely.
Yeah, there's a question that Donna asked, is age an issue for deep plane facelift surgery? And it's really not. You can do the procedure on a younger person or an older person, and quite frankly, I think they both, depending on their sort of anatomy, can benefit by the deep plane lift.
Absolutely.
And she also asked, how long will the deep plane lift results last? Well, I tell patients that when we do the surgery, it sort of picks them up on a conveyor belt of time and moves them back about 10 years. And the aging process continues, but they'll always be better than if they never had anything done. So I think that to some degree, the results will last indefinitely. They may want to do a little tuck-up procedure, even within 10 years or so, but they may not. I mean, I've got many patients that are 20 years out, and they still look good, and they're happy, and they don't want to do any surgery. So it just depends on the patient. So I think both the deep plane and some more conventional lift procedures can last a long time. But again, some patients I do think benefit more from the deep plane lift than others.
Yeah, exactly. I think at the end of the day, age is just a number, but tissues, recovery, things like that can be a little bit in the advantage of being a little bit younger. But I can't tell you how many patients of all ages that do extremely well with these surgeries. I feel like it's more attitude and personality is what kind of makes these things easy for most people. You can have all the things lined up that you want as far as, the person, anatomy, health, age, all that stuff, but the right mindset goes a long way. And I feel like the people who are spry and they sort of look in the mirror, and I tell patients this all the time, when there's a little disconnect between what they see in the mirror and how they feel, when you bring that closer together, that's where what we do here is really powerful for people. And I think if you're in your 70s or up to your 80s or in your 40s, whenever that gap gets a little large for you, we can kind of close that, you're going to be happy. But if you make it to, let's say, 75 and didn't do anything when you were 55, that doesn't mean that you're not going to have a great result. In fact, a lot of times that's the most spirited, fun-loving, life enjoying people that I know, and they love what we do. So it's kind of each sort of category, I guess, whether you do it kind of early or maybe a little bit later, I think has their pros and cons, and no matter if you're kind of older or younger. So.
Yeah, exactly. The age is one of those interesting things. A lot of patients will come in and they're very young. They may be even in their 30s and they're beginning to see some laxity that's really bothering them, especially if they've lost some weight. That can really be, even at a very young age, they'll have enough laxity that they can benefit by some tightening procedures. And so, when to do it, I tell patients when it's really starting to bother them is a time to consider doing it. And so I think that you can get a person that's just beginning to see some laxity, and they'll do a little procedure to kind of tighten things up. And they may do some tweaking along the years, every few years or so, and they kind of maintain things as opposed to a big rejuvenative procedure. And neither one is right or wrong. It's just the way the patient, wants to approach things. And so we have patients on both ends, those that wait until they've really, started to see some significant laxity, and then they do a big rejuvenative procedure, which is great also. And like you said, they can be some of the happiest patients around.
And I think that's what, I know you've seen it too. I mean, younger patients, I just call them younger, sort of going after more definitive procedures. Almost a mindset of, we still do a ton of fillers, but maybe not relying on the fillers to bridge the gap, but rather just going in and taking the plunge of surgery. And so you have that kind of crowd. And then with the semaglutide sort of medicines, I mean, we see a lot of kind of massive or big weight loss that does result in laxity in the neck and things like that maybe younger patients want to take care of. So that's a huge population too. So yeah, we definitely see the full gamut of, younger, everywhere from my youngest is in the 30s and my oldest is in her 80s. So it's a wide range.
God, I think that's exactly right. Let's see if there's some other questions. There was one for you here, Dr. Adams. Judy asked, I don't know if you want to attack that one or not.
Sure. So, big question is, what is the difference? I guess, maybe I kind of skirted that with the first question of what's the difference between maybe a more traditional facelift versus a deep plane facelift. And like I said, there's a lot of similarities, the layers that you're lifting and things. And, kind of the mindset that I have is, based off of mentors and other, surgeons that came before me. But I think one of the better ways that they describe it is that SMAS layer, there's maybe two, sort of segments of it, if you will. And in front of the ear, for most people, depending on, how old you are, that area can still be kind of tight or smooth, Where you start to see that aging process is maybe closer to the mouth, closer to the nose. And so there's a part of what's maybe thought of as the fixed SMAS, or the SMAS that isn't very mobile. And then there's mobile SMAS that you can really shift around in your face. And so, what I think of the big difference between maybe a SMAS technique or versus the deep plane is going closer to that mobile SMAS so you can get maybe a little bit greater force on what you're trying to move. But like Dr. Rousso said too, there's that evolution of the deep plane facelift that was described 30 years ago is now, talking about extended deep plane facelifting, which means addressing the ligaments that connect these gliding planes that are in our face to maybe the deeper structures and things. And so there's three, main, ligaments that we go after to release. And once you release those, it's such a gentle procedure. The deep plane facelift, without getting into the nitty gritty, it's sort of done within a embryologic plane. So, how we're created, our faces in layers. And so when we get in between those layers, it is a very smooth and gentle procedure with very little, blood loss and all these things that makes surgery a little scary. And once you're there, it's a very, sort of elegant, procedure. Like you said, that's where, especially an artist like Dr. Rousso, who's, not just talented in the OR, but actually, loves his art. That's where, as the surgeon, you get to really see how you're changing the face. Your vectors of pull are changing the face. And I think, our world is rooted in, I'd say very sound technique and more scientific things, but then there's always that surgeon's eye, that artistry that's involved as well. And that's always a really nice thing, that each deep plane facelift isn't, just sort of a one way for everyone. It's a very curtailed procedure to see how this person's tissue, sort of reacts to what we're doing versus the next one. And I think that's where you really get this nice rejuvenated look for each patient, and that's, I think that's the biggest difference, is where you're getting into the SMAS, what are you releasing, what are you able to do to the mobile SMAS to really give people not just a tighter look, but a rejuvenated look, a look that really takes them back in time, like Dr. Rousso was talking about.
Yeah, I think that's exactly right. You did a great job of explaining, those differences. And again, and this is something that the artistry is a big part of it. I mean, Dr. Adams is very modest. He's a very, very talented artist himself and does a beautiful job with these techniques. But again, the idea is that it should look natural, and you can be overly aggressive with these techniques, because like you said, once you release these ligaments in the face, you can move them more than what you may want to, or I shouldn't say want to, but more than what you should.
Yeah.
And so those are all really important factors in choosing a surgeon and choosing not only just the technique. The technique's important, and yes, there are definitely some advantages of the technique. The deep plane is a great technique, and it will allow us to do some things that we can't do with the standard, what we call biplanar or SMAS type lift. So yeah, it's something that everybody should at least be aware of and know the differences between, and then they can make the decisions about that. But we perform quite a few, since we only do facial surgery. We do a lot of facelifting here in our clinic, and so I think the idea, again, as I go back to, you want a natural look. I mean, that's really what the patients are looking for, and a safe procedure. So I think you can achieve all of that with the deep plane lift.
Sure.
Yeah.
But it looks like I kind of maybe stepped on the next question, but can
Can
you have a facelift from a lot of sagging skin or laxity with weight loss?
Yeah, the weight loss. Austin mentioned those things, and absolutely, you can definitely tighten things up nicely with a deep plane lift after losing some weight, and it's a key part of why we do some of this surgery is patients that have lost some weight. So that was a question that I think that Kelly had. There's another one here Mary had. I don't know if you want to tackle that.
Sure. Real quick about like the laxity and like the neck. Something I've sort of talked to patients about. It just jogged my memory about it. Is that we get caught up in like laxity, skin, and things like that, and that is a big component. Once you take that muscle layer and you're able to secure it and lift it where it should be, there's excess skin that we remove. But interestingly enough, a lot of the skin in the neck isn't necessarily excess. It just sort of follows the muscle laxity. And so, there's been another kind of proponent of lifting surgery as well, as in a way of like less is more, meaning that the more you're able to keep the skin connected to the muscle underneath, the better and stronger and more restored or rejuvenated the skin is actually going to look at the neck. And so, interestingly enough, you may feel like, wow, I have all this, excess skin and things. Once those muscles get tightened underneath with a pretty minimal skin undermining, same thing with around the ears. When you bring that skin up with that muscle layer, it's really powerful with rejuvenating that laxity in skin. And so, although we, think of it as a skin removal, the main thing is, like you said, a natural rejuvenation of things is to try and keep things as naturally intact as they were before we went and did surgery. And so keeping that skin connected to the muscle is actually a huge component of people, especially if they are pretty thin or lost a lot of weight and things, which is almost counterintuitive for some people. So that was just something interesting that I explained to a lot of patients.
Mary asks, can a deep plane facelift be combined with other procedures? Absolutely, Mary. You can do it with a lot of things, and we constantly will do lifts with eyelid or chemical peeling, things of that nature. Sometimes chin implants or cheek implants can be done at the same time. It just depends on what the patients need, and oftentimes even with the buccal fat pad removal, it can be done at the same time, and actually done from the incision around the ear as opposed to making incision inside the mouth. So it makes it even a little bit easier to do that type of procedure. So yes, you can do, and it oftentimes requires multiple procedures in order to get the patient where they want to be, because they may have big puffy eyes, and the deep plane lift really doesn't do anything to address that. It's not going to do anything to help with the eyelids. So we have to combine it with the blepharoplasty, the eyelid operation. And the fine lines around the mouth, the little wrinkles around the mouth, those really don't get affected by the deep plane lift. And you've really got to do something else, like a resurfacing, like a laser or a chemical peel or something of that nature to help. Or even fillers can be done to help with those types of things, either using their own tissue or using the hyaluronic acid fillers or other things to help.
And I mean, the vast majority of our patients, they have lived busy family, work, or social lives, or all three, and oftentimes the hardest part about taking patients through this journey is the 2 weeks of downtime. I mean, that's typically what most people need before they're getting out into public again and, you know, kind of being seen by strangers without thinking much of it. But that's the hardest part. And so with that in mind, you know, when people want to keep it focused, it's great. You know, if they just want a cheek lift or just upper and lower eyelids or just something, well, that's great, you know, and then you kind of check that box for them and they go off, live happy lives, and it's wonderful. But for people who are sort of looking to do maybe a more cohesive or comprehensive rejuvenation, I mean, adding things together is safe, it's cost effective oftentimes, and then it's mostly, you know, effective for minimizing the downtime. You know, a lot of people don't have, you know, time here and there every so often to just take off from life to kind of devote to themselves to heal. And so if we can kind of make sure that we hit different areas all at the same time, one downtime, that is beneficial for so many reasons, but most importantly for patients, it gets them back in action sooner, doing what they love to do, whether it's, you know, the work, the play, the family, anything. And so, yeah, oftentimes we sort of pack in whatever we can safely do that's required to get them to reach their goals, because at the end of the day, we just want happy patients. And, you know, I think limiting the time to the OR too is also a value for people. And so I think the more we kind of stack on, the better it can be for some people. But like I said, not for everybody. You know, there's a lot of patients that are so happy with keeping it very focused, and we're here for that journey too. But by all means, you know, to do multiple is very common and very safe too.
Yeah, I think there are some things that you're limited to be able to do at the same time, but we combine all in the swing of things
Right.
quickly, because most of the things we do take about 2 weeks to heal, whether it's a facelift, an eyelid procedure, or even a laser resurfacing. It takes about 2 weeks to heal, where you can start putting some makeup back on again.
Yeah.
And so within 2 weeks, if you do all those things at the same time, then you're back on track again.
Yeah.
So one of the other questions that somebody had was where are the incisions for a facelift, and so I've got this little model here, and typically what we'll do is we hide these incisions around the ear. In a woman, typically we'll start the incision in front of the ear right here, and then we'll go inside the ear canal behind this little piece of cartilage that you've got, so it hides the incision. You don't have a scar out here on the face, it's hidden inside the ear, and then it goes around the earlobe, back behind the ear, in the natural crease behind the ear, and then along the hairline back here, and that allows us to tighten up the neck and the cheek. Sometimes the incision goes up underneath the sideburn if we've got some extra skin there. Sometimes the incision will go up into the hair here. So there's different types of incisions that we will deal with depending on the sideburn sometimes, and the laxity that the patients have. Patients that have more laxity, we may need to excise a little bit more loose skin if they need it. There's also a very small incision under the chin right here for us to be able to tighten up those muscles in the neck that Dr. Adams was mentioning earlier. And sometimes we'll do a brow lift. We can make either 3 little incisions up in the hair if we're doing an endoscopic brow lift, or we can do an incision along the hairline, depending on what the patients need, a trichophytic brow lift. So those are the incisions, whether it's a deep plane or a conventional lift. Typically, we tend to hide those incisions. Some doctors will put the incision in a natural crease in front of the ear, which is okay. We'd like to hide that incision inside the ear, and that way that they typically don't see it. Sometimes, but the only time I will make an incision in front of the ears is in a man. We'll make an incision in front of the ear, because otherwise it takes the beard and it pulls it onto this little area of cartilage. And so typically on a man, we'll make an incision in one of these little wrinkles in front of the ear.
Mm-hmm.
Yeah. Okay.
Yeah. Well, no, that's great. I mean, incisions are a big question. I think, you know, it's interesting. The face heals so well, has great blood supply, a lot of the tissues and the little things inside of the skin that help it heal really well. So we're very fortunate as facial plastic surgeons, but there's a lot we go into as well post-operatively to help you heal well. But one of the kind of interesting things about the deep plane technique is that it truly does, by releasing a lot of the things that pull against the work that we're doing in a lift, those incisions are so tension free, they heal incredibly well. And photos and pictures that we have, you know, in our books and things show that. I mean, it's really a neat thing for just the overall healing and kind of hiding, you know, what we've done. Because, you know, the next question, Katie sent in something asking about what is the downtime, you know, for facelift. And Dr. Rousso had mentioned for most things that we do, it's a general blanket of, you know, 2 weeks. You know, I always tell patients I have one that we did just a, you know, kind of a lower facelift for, you know, Deep Plane, and she was for those of you who are watching from Birmingham, was in Gianmarco's on day 6 before the sutures were even removed, because her hair kind of covered, you know, the incision. She had very little bruising and swelling, and she didn't care. She just wanted to get out. And so that is very rare, I will say. I don't claim that, but it's amazing how everyone's a little bit different, I guess is what I say with the healing. And it can be sooner and it can be later. But most people at 2 weeks are running errands, getting out into public, and most people that don't know them aren't thinking that anything's off. But I tell people, you know, at 2 weeks, your best friends, your family, and things may say, like, something's going on, you know. So it really comes down to how much are you willing to let people know, in a way. For the patients who don't care and everybody knows, they can be getting out a little sooner than those who want to really kind of hide out. But most people by 4 weeks out, 6 weeks out, they're going to parties and functions and stuff like that, enjoying life, seeing friends, all that stuff. And then, you know, we always say give it 3 months. If you have like a big event, if you're going to be mother, father, the bride type of thing, where people are really staring down at you, give it about 3 months, because not only are you looking good, but you're feeling good at that point too, meaning all the little bit of maybe numbness that comes with incisions or tightness that comes with lifts, it just starts to fade away and things just are more natural and you feel more comfortable being out in like a big crowd.
Yeah, that's a good rule of thumb. You know, if you're going to be going to a big event and you want to get out, and the minimum time you need is you know, give yourself at least a month of healing. If you're going to be in the wedding, then you're better off giving it about 3 months to really allow things to start to feel a little bit more normal. You'll look good, like you said, quickly, but you'll feel a little funny, and that's one of the things that patients will ask us about, because you will have some numbness around the ears, typically lasts, you know, 3 to 4 months or so, underneath the chin, oftentimes 3 to 4 months until that feeling comes back, but it will come back, but it can take a few months until that comes back.
Absolutely.
Okay.
I don't know.
Have we got any other questions?
Yeah, I said, do we have time? The producer's saying we have a little more time.
Kenny did ask if you can perform a deep chemical peel at the same time as a deep plane facelift.
You can do a deep chemical peel around the mouth at the same time that you do a lift. Not a problem at all. You cannot do a deep plane facelift and do a deep chemical peel on the cheeks at the same time. I wouldn't recommend it. I think that there are some risks involved with that. Anytime that you do some undermining of the skin out here on the cheek, and you get real aggressive with the cheeks, or a plasma skin resurfacing on the cheeks at the same time that we do a deep plane lift. But I wouldn't do a deep chemical peel at the same time. That to me is pushing it a little bit much, or even a real deep erbium YAG laser may be a little too aggressive at the same time. Although I'm sure there are doctors who have done many patients that have done beautifully well with that. I just, in my hands, in my experience, I've been a little bit more cautious about that, so I don't get that aggressive with doing deep resurfacing on the cheeks at the same time I do a lift. But I'm very comfortable with doing it around the mouth, very comfortable with doing it around the eyes at the same time that we do the lift procedure. So we oftentimes will combine those, what we call regional peels or regional lasers, at the same time that we're doing the lift.
Yeah, absolutely. I agree. I mean, maybe because he trained me, but I would say, I don't mind doing laser resurfacing to the face when you're doing this, but like you said, very, you know, like everything in life, there's a spectrum, you know, of intensity when it comes to resurfacing, and that deep chemical peel to me is like the top dog as far as intensity. And then, like you said, you kind of have some intense lasers and less intense, and so the lesser intense things, which gets a great result, I think really balances the benefit while reducing the risk. And in our world with elective cosmetic surgery, anything we do, we want the risk to really be outweighed by any benefit. You know, we want the good stuff to be so apparent that the minor risk just allow us to safely get patients where they want to be. And if there's a little too much risk for the benefit, then it's just not worth it. And you know, because it could be 1 in a million, but if something, you know, an outcome for being too aggressive with resurfacing happens, that's 100% for that patient, and that is not something that we want to do. And so if it's not safe enough, we don't do it. And I agree. I agree with that.
Yeah, we're very conservative that way about patient safety, and so we'd rather just wait. And you know, if they really need some aggressive resurfacing out on the cheeks, they can come back and even do that later on. And we'll sometimes space procedures out that way for patients that really need that. If they have really severe sun damage, wind damage, you know, aging issues. Sometimes we'll break up the procedures that way. So yeah,
definitely.
Any other?
Yeah, so Anna would like to know if you can do skin resurfacing on the neck during a deep plane facelift and if it is safe.
Ooh, I'll let Dr. Adams talk about that, about whether or not you want to do resurfacing.
Yeah, I think that, like we talked about, the face is very good at healing. And part of that is because of the things that are within the skin of the face, like oil glands, sweat glands, hair follicles, those sorts of things. That's where stem cells exist to regenerate skin. So when you get these deep peels on a face, you get no scarring and a really nice result, improved collagen, elastin, all the things, complexion. If you did those same things to the chest or your arms and things like that, it could be devastating, like a burn and scars. I tell patients all the time, we just describe this incision that goes all the way around your ears and things and heals beautifully to where you're wearing ponytails and no one knows. But you could get like maybe even a scope, like an arthroscopy with like an orthopedist, where they do tiny little incisions on your shoulder, and those incisions can look more noticeable. And it's not because of the surgeon, it's because of the anatomy and the position and of the body that those scars are in. So as you get lower, that neck tissue typically doesn't have the same supporting cells that you need to get really aggressive with resurfacing. And so you can go very light on some fractionated CO2 lasers that we do and things. But in general, I feel like one of the most rejuvenating things is that neck lift, because like I talk about, when you leave that skin connected to the muscle and take it all up together, it can be super rejuvenating by itself. And then there's a lot of great spa level things, which, you know, to some people, maybe not the, you know, best thing to hear, because it requires maybe a few more trips than just one trip to the OR. But, you know, we have such great tools in the spa that really help with complexion and lines and things of the neck that are super safe, get great results. To me, a lot of times I'll funnel more of the neck concerns or chest concerns to the spa because it's just better. And it may take a series of treatments rather than just a one and done thing. But healthy skin in general is a lifestyle, not a, not an event, because it's just like good teeth or working out. You know, it's something that you have to stay up with, and you do your daily things, your intermittent, kind of more aggressive things. But, at the end of the day, there's not really a one and done for the skin. And again, it becomes a safety thing. And if the benefits don't far outweigh the risk, it's not worth it. And that's why doing aggressive things to the neck just aren't worth it.
Yeah, I kind of lateral that off to you in a way because it's one of those things that it can be different depending on the doctor's own sort of ideas, and I agree 100% with you in that I don't like to do resurfacing of the neck at the same time I'm lifting the neck. And again, but for those reasons exactly that you say, the neck does not heal the same as the face. Totally different. You can do the exact same thing on the face as you do on the neck, and you can get scarring on the neck, and you'll never get scarring on the face. It's just a different type of response to that skin. And so because of that, we have to be very, very careful about resurfacing that we do on the neck. Having said that, I think it's important, as Austin said, the lift that we do is designed to tighten up the loose skin that you have and the loose muscles that you have in the neck area. But the quality of the skin is a huge issue as well. And those patients that have a lot of sun damage, a lot of crepiness to the skin, they're still going to have some of that sort of sun damage and crepiness to their skin even after we do the lift. So that's where some of the procedures that we do in the spa really can help, whether it's a microneedling procedure, the radiofrequency microneedling procedures. Those are things that oftentimes help make the results even better.
Yeah.
And so, patients need to understand that. Sometimes they'll come in and ask me about things, in particular, and we have to give them some counseling that they're going to need more than just the lift alone, or at least they'll understand that there are limitations that we're going to get.
Setting expectations is a huge part of our job.
Yeah. Any other questions?
So Kat would like to know if a deep plane facelift can be done after you've had sculpture.
Yes, it definitely can. Sculpture, for those who don't know, is a type of, I guess, filler, but more of like a biostimulatory type filler where it's a product that gets injected, your body reacts to it, and it can really build up some nice collagen, increase blood flow to the skin, and give a little bit of a glow. So it really does a good job of volumizing the face, and it's a wonderful tool. But because of that, some people will talk about how, because it's building up collagen and things in the tissues, that it can make surgery a little more difficult or something like that. And so how I see it is that, he told me a long time ago, if we didn't operate on people who had filler in the face, then we wouldn't operate at all, because that's often, the type of people who enjoy, fillers and Botox and spa things eventually or at some point may funnel through the operating room too. So with that being said, it doesn't necessarily make it harder or more challenging necessarily, but I will tell you that if you lined up, 5 patients and one of which had, Sculptra or, even previous liposuction, heat devices to the face, all those things can create, more of that collagen in the face or in the tissues. I could tell which one was probably which, and like I said, it doesn't mean that you're not going to get as good a result necessarily, or that you shouldn't do it, or if it's not right for you. But it is worth a discussion. And, I think that's where some people decide earlier to do some of like their facial rejuvenation surgery. It's because they kind of hear the options for maybe injectables and say, that's not really for me. I'd rather do this. And then you have a lot of people like, how I would be, where you say, well, now's not the right time for the downtime and this and that. And so you end up doing more of the fillers and the Botox and things. So there's no wrong answer. I don't like, trying to say you're, great if you do this and terrible if you do that. But yes, you can tell the difference in tissues, at least I can, as far as maybe, which ones have had some products in them or, like I said, some treatments done to them. But I tell you, they still get good results. It's not like you shouldn't do it if you have sculpture, or don't get sculpture if you plan on having a surgery. So.
Yeah, no, I agree 100% with you there.
All right, so a lot of our followers want to know about lip lift, but I think that's a great topic for our next live.
Oh, yes, you get to do it again.
Yes. I'm committing them to their next live.
Okay, beautiful. All right.
Okay, so what do you think about facelifts in younger patients? So that will probably be our last question that we'll take.
Yeah,
but
sure.
Facelift, I talked about it a little bit earlier, facelifting in younger patients. It really depends on the patient. Especially if they've gone through some weight loss, we certainly will do patients in their 30s. And I've got patients in their 30s that need it a lot more than some patients in their 50s, depending on their particular anatomy. So the age is not really the issue. Patients, it's more about, what they're presenting with. And if they have the laxity and it's really beginning to bother them, then that's appropriate. There's nothing wrong with it at a younger age. The age is, like you said, just a number, and doesn't necessarily reflect, how biologically they're needing the lift procedure. So yes, it's totally fine to do it on a younger patient. On the contrary, it's totally fine to do it on an older patient too, as long as they're in good health. We will do patients in their 80s, but then again, there are some patients in their 60s that are not in good health, and they're just not good candidates for surgery. They may have other medical problems and issues that don't make them a good candidate for surgery.
Mm-hmm.
So yes, to answer the question about young patients, again, that's not a problem.
Yeah, no, I'd agree, and that's what I don't want to belabor the point, but you're exactly right. It's patient selection. What are your goals? When you're younger, I feel like you're in a gray area. Sometimes you could get some good results with injectables, fillers, that sort of thing. But then if you want a surgical result, well, then that takes a surgical procedure. And so, I think that's where discussions and consults happen, and you really get the nitty gritty about what it's like to do those different things, and you make a good choice, whatever's good for you, like as an individual. Because like I said, everybody's different, social, kind of pools are different, and, we just kind of curtail it to whatever the patient needs.
Okay. Well, we've sure enjoyed visiting with you this evening, and hopefully you've learned some things. Hopefully we've answered some questions for you and made it a little bit more comfortable for you if you're thinking about doing some surgery. It's not for everyone, like
Right.
you were saying, and some patients are not ready for it. They're ready to just do some fillers or Botox, things of that nature, which is totally fine. But surgery will accomplish things at certain points in your life. That surgery will accomplish things that the fillers and the Botox won't.
Yeah.
You're going to be limited at some point in your life to things that the fillers and the Botox will do, and then that's when the surgery really will come into play.
Yeah, absolutely. And like you said, thanks for joining us. It's as fun as. In all seriousness, getting educated about this stuff is really important. I think people who learn and understand a little bit more of what we're getting into have a better experience. So, keep that up. And like you said, always happy to talk, figure this stuff out together. And look forward to seeing y'all again soon, I guess, via live.
Yeah, all right.